Here's a segment from this month's edition of St. Charles Parish Today, a new monthly local talk show.
September 2010, St. Charles Parish Hospital broke ground on an emergency room redesign and replacement project. Since then, construction has been nonstop at the site, with 12,000 new square feet of space being added to the facility. Hospital officials say when the room opens in early 2012, it will facilitate shorter wait times, increase patient privacy, larger rooms, and technologically advanced equipment. St. Charles Parish Today staff recently took a tour of the new facility. Let's take a look.
Today we're here at the new St. Charles Parish Emergency Room, which is currently under construction. We have with us today two members of administration that are going to give us a tour.
Hi, I'm Fred Martinez. I'm the Chief Executive Officer for St. Charles Parish Hospital. This is going to be our new emergency room. There'll be two entrances into it. This one will be what we call our ambulatory entrance. The family members and patients would walk in some double sliding glass doors through an air curtain and be greeted by registration. The second entrance is the one further down where the ambulances would be coming in to drop off patients. They have a totally separate entrance, a separate not only entrance into the building but entrance into the treatment area. Some of the exterior is stucco. You can see all this kind of cardboard looking area. That's all eventually going to be stuccoed. The canopies will have a metal system that's going to be put on top of this here, and then this will be, the main driveway. It's just going to look really neat looking when it's finished. We had a help from Dr. Joseph Jurisco, who's the head of emergency medicine at Ochsner. He guided us in the design and the concepts that we're incorporating of patient throughput, which helps when you look at the concepts of what we're going to be doing. Then it form follows function, so that helps us design the emergency room. We also went to I think 6 different facilities that have the same concepts that we're incorporating, some in Arizona, some in Florida, and we talked with the physicians, the nurses, the ER directors there, and got a lot of input as to what things they liked about their ER, what things they didn't, what they do different, and eventually, we started putting it down on paper. The architects eventually got it to where we wanted it. Dr. Jurisco himself signed off on it, that he felt that was about the best design that we could have, given the number of patients that we designed it for, and with the space that we had available. So the main entrance for patients and family here, there'll be double sliding doors. Wheelchairs will be stored right here so that they're easily accessible for anybody that needs a wheelchair to get in. One of the end products, besides hopefully giving good definitive care to the patients that are coming in, is going to be to get the patients in and out as quickly as possible. You probably noticed that most of the hospitals around in the New Orleans area are now posting their wait times, either on billboards or you can look them up by phone. We're actually hoping to incorporate a sign. They're still working on that. A sign that will blink outside our wait time, our current wait time. So if you're thinking about stopping here and you say, I wonder how long it's going to take, you should be able to see it outside before you ever come into the building. So again, the idea is to get patients in and out very quickly. And so when you come in, the first thing you're greeted by our registration staff, which will be located right here, right by the door. Mainly the thing that they're going to take from you is your name and probably social security number. And then they'll hand you over real quickly to the nurse that's going to be doing what we call a quick look, which is the first clinical look at the patient. Now, if someone comes in actively bleeding or complaining of chest they don't even stop here. They skip that part of it. But if you just come in and you say, oh, I'm not feeling well, or, you'll stop here. But if we deem it, and even the registration staff, if they think it's a, true life-death emergency, you won't even stop here. They'll get you to the back right away. The idea is to not have to go back anywhere else to a waiting room. The idea is to get you right to the back. That's what we're going to really strive for. So you stop here just so the nurse can get a few initial, some initial data that they're going to need in the back. But then hopefully they'll be able to take you right to the back unless we're really full. But we've got so much more treatment area that shouldn't be the case. Now the family that's coming with you, will allow one family member to go in the back until the doctor can allow more people. But the family would wait right out here. There's a couple of defined waiting areas.
My name is Jean Hill. I'm the Chief Nursing Officer and Clinical Officer here at St. Charles Parish Hospital. We do have 3 levels of care, and less sick, which is actually 30 minutes or less. We expect that the patients that come in with lower levels of need will go into the less sick rooms. We have 4 less sick rooms. So again, 30 minutes or less in those rooms. We have 7 more sick rooms for more of the emergency type needs, patient needs. Our current turnaround time is about a little over 2 hours. So the goal there is, again, to get patients in and out in 2 hours. Then we do have 2 trauma rooms for the code type situations and any people that that probably is going to need a high level of care. As Fred was also talking about, we do have some mental health or a secure holding area for those behavioral health patients that come into our ER. And trying to move patients through our ER, we also have an internal waiting area. We don't want patients to have to sit outside of the ER. Once you come into once you get through the quick look and quick reg process, the goal is to get you into one of our rooms. And the way that we do that is that once you are you have all, seen by the nurse, seen by the physician, have your x-rays and labs done, and we're just waiting for results. We do have an internal waiting area that you can be seated in, where you can wait for those results and get discharged from that area. So we do have 2 nurses stations. It's all centrally located around all the rooms, so we can easily see all the rooms. We do have separate areas for physicians so that when they come here, they can dictate, look at all the patient's information. A consulting physician can come in. They can consult with the ER physician. We have medication areas, nutritional areas, so that we can better service the patients that come through here.
All the rooms, no matter what level of care, they're all going to have some new Hill-Rom head walls, which incorporate all the technology that we use on a patient. So depending on the level of care, we'll have a specific head wall designed just for that. This is the ambulance entrance. Ambulances will pull right up to that door, bring the patient in. One thing that we're adding that we don't have right now is a decontamination room that's accessible from the outside. So someone gets exposed to some type of chemical that needs to be taken off of them real quick. They'll be able to come into this room right here. They'll be decontaminated in there before they ever come into the emergency room. Also, another thing about this particular hallway is it's going to be our overflow. A fair amount of times during the year, we either have a chemical release or a bus accident, and all those people, rush into the emergency room, and sometimes it's not unusual for us to get, anywhere from 50 to 100 patients come in as a result of something like that. So we're always then swamped, and so what we did is we designed this corridor just for that. So normally a hospital corridor is 8 feet, so we designed this one 12 feet from here on, and you can see there's little dividers, but this is where we will line everybody up, because it's important for us to triage everybody as fast as we can. Now whenever we're building, we keep the lessons learned in Katrina, as we design new areas. And basically, we need areas for the staff to be able to, sleep. We need areas for them to be able to shower and get cleaned up. And so we do, build those things into our new expansions. Back here's the ancillary hallway. There'll be storage areas, clean and dirty storage areas. There will be the physician office, and again, sleep room and showers and stuff for them to be able to use in case of emergencies. In addition to providing good clinical care, we're also very concerned about safety and security of people that come on campus. So we do have quite a bit of video surveillance that's taped at all times. With the addition of the new ER, we're actually going to have a new video surveillance room located in the emergency department, where our security guards will be able to literally watch 100% of the campus by video surveillance. And if anything happens, they can immediately call the police department and have pretty quick response. We broke ground in end of 2010, and we will be opening the new emergency room in hopefully March of 2012. The cost is close to $4 million.
Very excited and very happy to have this opportunity to serve the public in such a nice way.
We're very excited about the new emergency room. We've done many projects through the years, and this is, I think, going to be one of our nicest projects that we're bringing to our community.
The ER grand opening is set for March 2012, and all of the community will be invited. If you have any questions, you can get in touch with the marketing department here at the hospital.
Catch the entire episode right here on Channel 6, daily at 5 p.m., or watch anytime at scptoday.com.